Hello everyone. Now we are going to discuss about the topic of coronary artery disease. First we will discuss about definition of coronary artery disease. Here we are seeing narrowing or blockage of the coronary arteries. The fat deposit is present on the arteries. It's caused by atherosclerosis. Its meaning abnormal accumulation of lipids, fatty substances, fibrous tissue in the vessel's wall. Next, we will move to causes. Development of atherosclerosis. Coronary artery disease is thought to begin with damage or injury to the inner layer of a coronary artery. Sometimes, as early as childhood, the damage may be caused by various factors, including smoking, high blood pressure, high cholesterol, diabetes, or insulin resistance, sedentary lifestyles. Next, we will move to pathophysiology. Due to causes, for example, high fatty diet, hereditary or other, it leads to lipids or cholesterol formation on endothelium layer of artery. It leads to formation of fatty streak. It leads to proliferation. It leads to formation of fibrous plug. It leads to partial or complete blockage in coronary artery. Next, we will move to symptoms of coronary artery disease. In cardiovascular system, angina pectoris, ischemia, low cardiac output, bradycardia, it means decreased pulse rate, hypertension, myocardial infarction, diaphoresis, excessive sweating, ECG changes, ST segment and T wave changes also show tachycardia, bradycardia or dysrhythmia. Then in respiratory system, dyspnea, it means shortness of breath, pulmonary edema, chest heaviness, fatigue. In genitourinary, decreased urinary output may indicate cardiogenic shock, gastrointestinal nausea and vomiting. In skin, cool, clammy, diaphoretic and pale appearance on skin. Next, we will move to diagnostic evaluation. Here, physical examination, history collection, stress test. That means treadmill test. Chest X-ray, ECG, electrocardiogram. Last one is echo. That meaning is echocardiogram. Next one, cardiac catheterization, angiogram. This procedure is most often done to get information about the heart or its blood vessels. It may also be done to treat some types of heart conditions or to find out if you need heart surgery. Your doctor may perform cardiac catheterization to diagnose or evaluate causes of congestive heart failure or cardiomyopathy. Then we move to complications, chest pain, angina, heart attack, heart failure, abnormal heart rhythm, arrhythmias. Then we will move to prevention. Quit smoking, control conditions such as high blood pressure, high cholesterol and diabetes. Stay physically active, eat a low fat, low salt diet that's rich in fruits, vegetables and whole grains. Maintain a healthy weight, reduce and manage stress. Next, we will move to medical management. Various drugs can be used to treat coronary artery disease, including vasodilators. These drugs act as blood vessel dilator. For example, nitrates. Beta blockers decrease workload in heart. For example, propranolol 20 to 40 mg. Then calcium channel blockers, they improve coronary blood flow. For example, nifedipine. Next, anticoagulant drug heparin, opiate analgesics for reducing pain, morphine sulfate. Next, thrombolytic drug streptokinase, urokinase. Next, antihypertensive medicines, methyl dopa. This medicine is used alone or with other medications to treat high blood pressure, that means hypertension. Then sodium nitroglyceride. It is used for lowering the blood pressure. Next, amlodipine. Amlodipine is used with or without other medications to treat high blood pressure. Next, surgical management, angioplasty and stent placement, percutaneous coronary revascularization. Meaning of angioplasty: using a balloon to stretch open a narrowed or blocked artery. However, most modern angioplasty procedures also involve inserting a short wire mesh tube called a stent into the artery. During the procedure, the stent is left placed permanently to allow blood to flow more freely. Coronary artery bypass surgery. It creates a new path for blood to flow around a blocked or partial blocked artery in the heart. The surgery involves taking a healthy blood vessels from the chest or leg area. The vessel is connected below the blocked heart artery. The new pathway improves blood flow to the heart muscles. Next, we will move to nursing management. Instruct the client regarding the purpose of diagnostic, medical, and surgical procedures and the pre and post procedure expectations. Assist the client to identify risk factors that can be modified and set goals that will promote change in lifestyle to reduce the impact of risk factors. Instruct client regarding a low calorie, low sodium, low cholesterol, low fat diet with an increase in dietary fiber. Stress that dietary changes are not temporarily and must be maintained for life. Provide community resources to client regarding exercise, smoking, cessation and stress reduction. Then we will move to nursing diagnosis. Impaired gas exchange related to decreased blood flow as evidenced by breathlessness. Next, acute pain related to disease condition as evidenced by patient verbalization. Impaired physical mobility related to weakness as evidenced by patient is unable to perform daily activity. Imbalanced nutrition less than body requirement related to less intake of food as evidenced by weight loss. Thank you.